Hey everyone, welcome back to another video. In today's video, I'm going to show you how you can pass your NCLEX RN in 75 questions in 2021. I have a set of review videos. Also, I have an NCLEX RN review playlist that you can take a look at. If you want to gain more information about nursing, please consider subscribing down below. I would greatly appreciate that. Also, please be sure to give this video a thumbs up. It took a long time making this video, and I would greatly appreciate it if you just give this video a thumbs up. Now let's get on to today's topic, which is passing the NCLEX RN in 75 questions. So in this video, I'll be going over specific strategies that I highly recommend you understand when you're going to study and write your NCLEX. I wrote the NCLEX last year and I did well on it, and I want you guys to know that you can do it too. I'm not smart by any means. I just put in the work, I studied a lot, and I watched a lot of videos like this one. Also, I did a lot of research on what nursing resources are good for me to use in order for it to reflect very similarly of what the NCLEX is going to be like. Also, I want to mention that in the description box, I do have a free ebook for passing the NCLEX, going into specifics of what I did, and it's absolutely free. So you want to check that out in my website, www.simplefitnurse.com. Also, stay tuned. By the end of this video, I'll show you exactly how you can do that. So here's some things that I think you should know when you're going into writing your NCLEX. So the first thing that I really recommend you guys to do is identify your weak areas. The NCLEX shows no mercy. It tests you on all the different areas of nursing. And while that might be outrageous, it's just the truth. I had to know about maternity, mental health, and pediatrics, and I was really bad at those. And I highly recommend, if you don't know what you're bad at, or if you did really well in nursing school all throughout, look at your nursing school scores, your percentages, and base your level of knowledge on that. So if you did well in maternity, don't study that as much. But if you did poorly on pediatrics, for example, focus your studying on that. I also recommend you doing a lot of practice exams, specifically in those areas that you're weaker in. So I used UWorld in order for me to identify areas that I was weak in, and I studied more specifically targeted into those areas. With that being said, I definitely reviewed all of nursing content. And the best way to do that is to download or buy a review book. I purchased Saunders' NCLEX Comprehensive Guide. I'll have a link down below where you can see the exact book I'm talking about, and you can purchase it if you like. This book is quite helpful because it goes into the depth of what you need to know for the NCLEX. And again, this may seem outrageous. It might seem a lot of information that you need to know, but it's definitely an area that you need to increase your knowledge in, and it accurately represents the detail that's necessary for you to pass the NCLEX. The next tip I have is practicing select all that apply and prioritization questions. So once you learn the foundational or the fundamental nursing knowledge is what I like to call it, it's just basically you have a good concept of all the different areas of nursing. The NCLEX wants to challenge you and see if you're able to meet their passing standard. And the way they do that is by asking you prioritization questions and select all that apply questions. So you know you're typically doing well on the NCLEX if you get a lot of select all that apply questions or prioritization questions. So knowing this and knowing that you've studied the content a lot, you want to practice select all that apply questions or prioritization questions. If you think that you're really good at those questions and you're getting every other question right and you're doing really well in them, then that means you're doing very well and you're in good shape for the NCLEX. Another thing that's important with select all that apply and the NCLEX is the fact that the NCLEX will test you on stuff that you can't possibly memorize. And I know you might be thinking, well, I'm really good. I'm a really good student. I memorized everything. I got 95 in everything. But believe me, there will be something and some topic that you will have no idea anything about, but it will show up on the NCLEX. And the reason they do this is because they want to assess your critical thinking skills. They want to know if you're able to identify the question, comprehend the question, and be able to differentiate between answers that are completely out of the ballpark or answers that could be correct, and you have a 50-50 question, 50-50 chance of getting it right. Speaking about comprehension, a very important aspect of the NCLEX is comprehending what the question is asking you. The NCLEX will ask you questions in a very tricky way. They'll always ask, what is the most likely to happen, or what is the priority, or what is the least important task for the nurse to take? All these different ways of asking these questions are a way of being able to assess your comprehension. So what I did to practice this was to do a set of questions, but not actually do the questions themselves. I would go in, read the question, and write a one word of what I think the question is asking me. This not only helped me understand the question better, but it also increased my speed at which I would answer questions, which is not too much of a priority, but it is a time-limited exam, so you definitely want to make sure you do questions within a good amount of time. Lastly, the NCLEX has 75 minimum questions, and it also has a maximum of 145 now in 2021. So what that means is each question is so important for your score, your ability for the NCLEX to see if you meet the passing standard or not. So for the NCLEX to identify that, you need to be able to answer a lot of questions correctly. So I highly recommend taking your time and making sure that you're confident in your answer while you're writing the exam. Anyways, guys, those are a few tips I have. Please check out the description box for other resources that I have talked about or that I've written about. Anyways, we'll catch you in the next video. Thanks for watching.
So first you want to go on to my website www.simplefitnurse.com. Then you want to go on to my books here. And then after that, you want to just click over the book that you want to download and click the download link, and it will automatically pop up in a PDF form. Thank you so much for watching this video, and we'll catch you in the next one.